Hey guys, welcome to my channel Dentistry with Kashyap. It's a part 3 series of our head and neck anatomy. Let's talk about the muscles of mastication. Muscles of mastication are the group of 4 pairs of skeletal muscles which are responsible for the movement of mandible during chewing, speaking, and swallowing. It developed from the first pharyngeal arch called as branchial arch and are supplied by the mandibular division V3, and sometimes it is also called as mandibular arch. Okay, number 1 is your masseter muscle, this big green one. What is origin and insertion? It originates from the zygomatic arch, here the zygomatic bone, and inserted into the lateral surface of the ramus and angle of mandible. Talking about its nerve supply and blood supply, nerve supply is from the mesenteric nerve and the blood supply is mesenteric artery and facial artery. Moving towards its action, so it is your powerful elevation of mandible. Okay, it is assist the protrusion, superficial fibers help in protrusion and deep fibers help in retrusion. So here what you see? You see it causing your closing of mouth like elevation, your protrusion and retrusion. These are the basic actions of your masseter muscle. What are the clinical importance of this muscle? It is the strongest muscle among your muscles of mastication, and it is the strongest muscle during biting. Frequently involved in bruxism and common site of muscle tenderness in TMJ disorder, like mostly your facial pain. Second is your temporalis muscle, this big giant muscle. Here you see the origin in the temporal fossa and temporal fascia, and it is inserted into the coronoid process and anterior border of the ramus. So you can see here from medial surface, interior border of the ramus, okay? The nerve supply is from the deep temporal nerve and the nerve supply is from deep temporal nerve and the blood supply is from your superficial and deep temporal artery and vein. And what are the functions of this specific muscle that elevates your mandible and posterior fiber retract the mandible? So what you see, closing your mouth like elevating the mandible, and also it is also retracting, retruding your mandible. Okay, what is the clinical importance of this muscle? This pain may be felt in the temporal region. If this is tender, you will feel some temporal headache like tension headache, clenching, and tenderness occur in some specific area. This area will be yours irritated. Okay, third muscle is your medial pterygoid, guys. Look at this one. Origin and insertion. Origin, it has two heads. One is a deep head and the other is a superficial head. The deep head is a medial surface of the lateral pterygoid plate, like it originates from there. And the superficial head is originated from your maxillary tuberosity, from here. These two, okay? And it is inserted into the medial surface of the mandibular angle. They just cross-sect it from here, so you can see that. The nerve supply and blood supply is from, like you see here, is a medial pterygoid nerve. And also the blood supply from the maxillary artery branches. We already covered the maxillary artery in detail in our first series of head and neck anatomy. So go there and watch it. Okay. What are the actions of this specific muscle? We said that our medial pterygoid. It elevates your mandible, like it closes your mouth, protrudes the mandible, and also produces side-to-side movement, like your grinding, your chewing movement. Then clinical importance, as we said, what is the role? So that will be its clinical importance, like it forms your muscular sling with the masseter, like it work with that and forming your grinding, like helping in grinding and chewing your foods. And the last but not the least is your lateral pterygoid muscle, this big one. It also have two heads, the upper head and the lower head. So the upper head originated from the greater wing of the sphenoid. You cannot see here basically in the skull anatomy from if you do it upside down, so you can see it visibly there. So the greater wing of sphenoid and the lower head is from the lateral surface of lateral pterygoid plate. So in some video, I'm going to cover the bone anatomy of your skull. So there I will show you these structures carefully. So stay tuned for that part. And it is inserted into a neck of the mandibular condyle and capsule and disc of TMJ. Like, think about it. This might be associated with your TMJ. Like, now it is going to insert in your capsule. So any problem here will lead to TMJ disorders. Here, the nerve supply is from the lateral pterygoid nerve, okay, and the blood supply is from the pterygoid branches of your maxillary artery. We have already covered the maxillary artery in detail. Go and watch that. And what are the different functions, actions of this specific muscle called as lateral pterygoid? It protrudes the mandible, open the mouth, and also side-to-side movement. If you see here, the medial was basically, that was basically closing your mouth, and it is opening your mouth. So these two muscles were opposite, but the common function these both have is side-to-side movement, like the grinding movement, like the chewing movement. And it was the articular disc forward during opening. So any problem here will lead to your TMJ disorders. Okay, the clinical importance you see is a dysfunction can contribute to TMJ disorder and muscle spasm related jaw movement, like restricted jaw movement. And that's obvious due to anatomy. Okay, what are different movements of mandible? Your elevation, depression, protrusion, retrusion, and side-to-side movement. Elevation is done by your masseter, temporalis, and medial pterygoid, and depression by lateral pterygoids, and also assisted by suprahyoid muscle. Also, protrusion by lateral pterygoid, medial pterygoid, retrusion by your posterior fibers of temporalis and masseter, okay, deep fibers of your masseter. Side to side movement, of course, medial and lateral pterygoid. Okay, guys, what is this? This one is your elevation, and this one is your depression. And the opposite, this is called as closing of mouth, and it's called as opening of mouth. And this is the protrusion, and this is the retrusion movement. And this is side to side movement to the right and to the left. And you watch this diagram and practice which muscle can do that. Like touch it, like do such movement, and try to palpate those muscles. Okay. And there are some also other movements of your mandible, like circumduction and lateral translation. Okay, what are the different muscles used during mastication? We said it, we already discussed it, but let's revise it. Okay, opening phase is done by your lateral pterygoid when it contracts and suprahyoid muscle when it assess. It is the only muscle which can cause opening of the mouth, and the remaining basically close the mouth. The closing phase is done by when your masseter contracts, your temporalis contracts, and your medial pterygoid contracts. So 3 muscles are working together to close your mouth. And also the grinding phase is done by your alternate contraction of your pterygoid muscle, like both lateral and medial pterygoid muscles are involved in side-to-side movements. Then let's talk about like what structures, like what things basically holds them, like your muscles to the bone, and the movement is restricted and your muscles and bone are stabilized and properly functioning on the correct time. So we have the structure called as tendons and ligaments. Yes, we heard that in our human anatomy. Everybody, you heard that. You know what is tendon and what is ligament, but specifically let's talk about tendons and ligaments which are associated with your muscles of mastication. So let's go there, guys. It's going to be very fun. Okay, tendons. Each of the 4 muscles of mastication and in the tendons where it is inserted into bone, like temporalis tendon, masseter, medial pterygoid, and lateral pterygoid. It is very easy to memorize. Like you have 4 muscles, so there are 4 tendons. Let's see it diagrammatically. Okay, do not panic here. It is very easy. This is your cross section of your skull upside down. You see here's a temporalis tendon. You see here's a medial pterygoid tendon. You see here's a masseter tendon, and you see here is a lateral pterygoid tendon. So basically, you need to remember the names. If they ask insertion and origin, then you have to tell it. But if they're not asking, then don't try to explain it. Because this is very a bit tricky to memorize, but if you practice it anatomically rather than memorizing it, so you will learn it for a longer period of time. So this is basically a smart tip I used to do in anatomy, but I never studied books for anatomy, but I used to study that Atlas book, which I almost forget. But at that time, for short-term memory, we used to watch those pictures. I used to learn diagrammatically. Okay, let's get back to our topic. Okay. The temporalis tendon is your strongest tendon. It passes deep to the zygomatic arch. Here you can see a bit here. Okay. It means that onto the coronoid process of anterior wall of the ramus mandible, but basically you have to learn it, okay? You have to memorize it. The second is your masseter tendon, short, thick tendon, and it is inserted into the lateral surface of the ramus and angle of mandible. The third one is your medial pterygoid tendon. It is formed by the inferior head. Like we said, it has 2 heads, okay? And inserted onto the medial surface of the angle of mandible like pterygoid tuberosity. The fourth is basically I clicked it by mistake. Upper head inserted into the articular disc and TMJ gives you, and lower head inserted into the pterygoid fovea. Still, like you have 2 heads here and 2 here. So of course it will have 2 tendons, and specifically it has 2 also. Lower head is inserted into the pterygoid fovea on the anterior aspect of the neck of mandible. And this is the dorsal view. I just forgot that. Each of the 4 muscles of mastication and in the tendon is inserted into the mandible or TMJ and structures in cases of lateral pterygoid. Okay, now proceeding towards our ligaments. Remember 4 tendons and 3 ligaments. 4 and 3. 3 and 4. Like you can remember it easily. 3 and 4. 3 ligaments and 4 tendons. Ligaments associated with mastication, like your TMJ, is a main temporomandibular, also called as lateral ligament, sphenomandibular ligament, and stylomandibular ligament. What they basically do, that just stabilize and restrict the movement and assist the movement of your mandible associated with the muscles of mastication. Here you see the temporomandibular ligament. Very easy diagram, very easy. You can see here's a strong band, broad band on the lateral side of the TMJ. This is your TMJ. From the zygomatic, there will be a zygomatic bone, to the neck of mandible. To the neck of mandible, this is the neck. What it actually do, it mainly stabilizes the ligament of TMJ, and it limits the excessive posterior movement of the mandible. Like it prevents your mandible to go very back into, like away from your main TMJ area and back to the retrodiscal tissue and causes any damage to that tissue. So, will you remember this thing? This is your temporomandibular, your temporal bone and your mandible. Okay, the second is the sphenomandibular ligament. Very beautiful diagram, very easy, very basic. Lingula of mandible and spinosphinal. Between here is the band called as sphenomandibular ligament. And it is related to the medial pterygoid muscle and limits excessive opening of the mouth. The third is a stylohyoid ligament. Sorry, this is not a stylohyoid. It might be a stylomandibular ligament, okay? Because it is between styloid process and the mandibular. This is a bit wrong here. Corrected. Okay, it originated from the styloid process to the angle of mandible and is related to the stylohyoid muscle. There will be some muscle and it is associated with that. It limits the protrusion and side to side movement. Remember what it is limiting. Okay, in case of muscles, you are going to remember what it actually causes, but in case of ligaments, you are going to remember what it actually restricts. Okay, because its main function is to restrict and stabilize. What is the clinical correlation of muscles of mastication or associated structures? So here's a bruxism and TMJ disorder, trismus, and inferior nerve block. So these are the 4 basic things every dental students know. Any BA student or anybody who is studying head and neck anatomy. Bruxism is overactivity of your masseter and temporalis muscle. TMJ disorder, we already said like which muscles were related to it, like lateral pterygoid. Into that capsule we're inserting. Okay, if you remember that we discussed. Pain clicking, limited jaw movements due to muscle dysfunction or disc displacement. Then trismus is a painful restriction of the mouth opening which is caused by the spasm, infection, trauma, surgery. It's a multifactorial, okay? Trismus is a multifactorial. Inferior alveolar nerve block. So the knowledge of the pterygoid muscle is important for the correct injection technique. You have to learn anatomy very clearly for the successful LA by inferior alveolar nerve block, okay? You have to study it and remember that there are variations in the same gender, same species. So this is based on your clinical skills. Also your academic learnings. Okay, let's summarize the whole thing, guys. This one is your temporalis muscles, this is your masseter, this is your medial pterygoid, and this is your lateral pterygoid. Easy, right? This is elevation, this is depression, this is protrusion, and this is gliding movement, like side to side movement. And try to learn which muscles were causing the specific movements. Okay, I have some MCQs for you guys. Can you please solve them? Which muscle primarily depresses the mandible? If you remember, there was only one muscle which was doing such function. Do you remember it? If yes, mark your answer and we will discuss it later. Okay, number 2. The nerve supply of the muscles of mastication is. Think about it. Facial nerve, glossopharyngeal, mandibular, or hypoglossal? Mark your answer and note it down. Okay, the third part, which muscle inserts into TMJ disc? Very easy. I was telling you again and again in that slide just to focus on that point. Masseter, temporalis, lateral pterygoid or medial pterygoid? Okay, which one is the best option? Note it down. Okay, so this is the correct answer. You can match and tell in the comments like you score 3 by 3. 2 or 1 or 0. I don't think anybody can score 0 because I have already discussed the whole points in the whole lecture if you listen it carefully. Okay guys, thank you so much for watching. And don't forget to share and subscribe to my channel and share with your friends. And yes, I have started the anatomy series, so you have to stay focused and stay tuned for the next parts. And for then, bye.